House ball culture, to me, it really is another family.
I feel like house ball represents the LGBT community by expression.
Ballroom was created as an underground culture to let the kids express themselves, where like in society they wouldn't be able to. We can be models, we can be runway divas, we can, be the best dancers ever, and we're all there just to have a good time. When I was young and doing my transition, we didn't have anything. All we had were the streets.
Project Silk is a recreation-based community health space. The impetus behind starting Project Silk mainly came from a series of focus groups that we were doing. We focused specifically on young Black men who have sex with men and trans women here in Pittsburgh. And one of the things that they said to us that really resonated with me was there's nowhere for us to go. And they weren't talking about services necessarily when they said that. They were talking socially. There's nowhere for us to go. There's nowhere for us to really be and feel like we belong here in Pittsburgh. They were really expressing isolation, alienation, lack of social support, all of these social determinants that we know are predictors for HIV risk and for HIV infection. And we thought, well, wouldn't it be interesting if we took some of this information and really developed a program that's community generated, that gives them a safe space to operate, to be themselves, to feel okay about themselves, and to avail themselves of services such as HIV testing. If we can build all of those things into an existing community space where people want to be, then they'll probably use that.
A lot of people don't like to talk about the real issues because they're afraid.
We have fun with different things, but the main, subject is to make sure that the kids are okay, that they're safe, that they have what they need.
What we like to do here at Project Silk is that we like to have open discussions, not just about status in general. We touch on stigma, we touch on people living with HIV and AIDS, and through all of this, we are addressing how do we deal with people and that the fact that they are still human.
Everyone that comes here does not identify as gay, or they do not belong to a population that is high at risk for HIV. So I try to make sure that everyone that comes to our doors is knowledgeable about HIV and knows the facts, so that when they're going out into the community, not only are they aware and they're not spreading stigma, but if stigma is around them, they can address it in a knowledgeable way.
Reaching young Black MSM is about access and comfort level. We aim to be a comprehensive sexual wellness center as well as a social service provider.
I think within the Black gay male community, there is a palpable fear of institutional discrimination within the medical system.
Black MSM have been marginalized both because of their sexual orientation and because of their race.
It is a priority on our end to help people advocate for themselves to get the care that they need and navigate that system with them.
I think that traditional services don't often work for the population that we work with, and it's important to be able to have flexibility as well as structure.
My work is very non-traditional. I try to meet people where they're at. If people are having a hard time engaging into care, I try to make meetings with them off-site. I'll do anything I need to do to get that person into care. If you decide to get tested here and you were to test positive, I try to get you linked to care within that day. Linked to care means that we schedule you an appointment at a clinic or with a doctor and you're seen.
One of the things that we think is that PrEP access and uptake will also provide an avenue for folks to get regular HIV testing every 3 months and regular STI testing every 3 months, because those are part of the PrEP delivery model. And we think that that's going to be an avenue for primary medical care in general for a population that maybe doesn't get a whole lot of normalized primary medical care. And we think that this model might really bring folks into kind of lifetime medical care access and uptake and really reducing disparities. The people that we have on staff here, they don't just inform the program. They are the program. The program is nothing without that.
I think poverty is a public health problem, and the disproportionate rate of HIV infections among Black gay men in low-income communities makes this work relevant.
When you have someone who is in a position that can produce change to other individuals, and they look like them and they talk like them and they can just relate to those people. Those are the people that they're going to come to, and they're going to like build them rapport naturally with.
We want people to feel comfortable and feel at home. And if they're coming in for the first time and they're seeing staff that they might not know from the community or might not be able to relate to, we feel like that could be unwelcoming for some folks. And we want to make sure that we offer them a place where they feel the most welcome that they can.
We don't have a specific traditional defined trajectory of success. That is something that they are defining for themselves.
Project Silk uses the voice of the community in their programs throughout the YAB. That's the Youth Advisory Board. The Youth Advisory Board is 8 members. I'm one of them. And we collaborate and decide on which the activities are going to be and which parties and which type of outreach we're actually going for.
The Youth Advisory Board is Project Silk's way of having a direct ear to the community on what they would like to see happen in Project Silk.
When people and service providers are meeting, they should invite the community to the table to also be a part of those discussions, because we know how to reach each other, we know what each other go through.
Before anything happens, if it's something serious that we are trying to incorporate into Project Silk, then having them sit down with the Youth Advisory Board is the first step to the process.
So for us, it's always been incredibly important to reflect the people that we serve. We really believe that community-generated solutions are the only ones that are going to work long term.
It's very important that when we're hiring Black gay men, that they should be groomed into becoming leaders for these programs that are catered to young Black men.
The most inspiring thing has been seeing them evolve over the past 3 years and really establish this organic mentorship with each other. It is our main goal to work ourselves out of a job, and I think that we're doing that here.